All right, let's talk about a corner of the medical world that is, well, massively misunderstood. We're going to go behind the scenes, away from all the noise and chaos, into a world of shadows and screens. Today, we're really pulling back the curtain on the silent reality of radiology.
So when I say radiology, what's the first thing that pops into your head? For a lot of people, it's known as the chill branch of medicine. But is it really? That's the big question we're going to unpack right now.
You know the stereotypes, right? First off, there are no ward rounds. You're not racing from one patient's bedside to the next.
Then you've got this setting, a nice, quiet, air-conditioned room, far, far away from the madness of the ER or the operating room.
And of course, the classic image, endless cups of coffee while you kind of casually glance at a few black and white images. Sounds like a dream job, right? Well, let's talk about what's really going on.
So let's step into their world for a day. It doesn't start with a doctor greeting a patient. It starts in the dark.
A radiologist's day begins like this. They walk into a room that's only lit by the glow of these huge, high-resolution screens. And there's already a line waiting for them. Not a line of people, but a digital queue of cases. CT scans, MRIs, X-rays. Their patients are already there, waiting inside the system.
And then the scan marathon kicks off. There's no easing into it. You just dive straight in. First up, a CT of the chest. You're flying through hundreds of images, these tiny slices of a person, looking for that one thing that's wrong.
The second that report is filed, boom, the next case is already loaded, an MRI of the brain. The stakes just went through the roof. Is that a stroke? A tumor? You can feel the clock ticking.
And it just keeps coming. Next, an ultrasound of the abdomen for someone in excruciating pain. And every single one of these scans needs a super detailed report, a final conclusion that other doctors are going to use to make life or death decisions.
You see, this completely reframes the idea of a doctor's rounds. The marathon a radiologist runs isn't physical. It is a brutal, relentless mental sprint. They're not running between hospital wards. They're jumping between incredibly complex imaging sequences, each one a different chapter in a patient's story.
And that brings us to the absolute heart of the job. This isn't just about looking at pictures. This is a high-stakes game where every single pixel, every tiny shadow could be the key to everything.
Just try to wrap your head around the volume here. A resident might be responsible for reading over 100 scans in one shift. That's 100 different people, 100 different potential diseases, 100 chances to be right or to be devastatingly wrong. The pressure is just unreal.
And think about what that really means. If you miss one tiny, almost invisible detail, a small bleed on a brain scan, a hairline fracture, that's not just a simple mistake. That can lead to a catastrophic outcome for the patient, and frankly, for your entire career. It can become a lawsuit, just like that.
All of this intense screen-based work, it comes at a price. There's a hidden human cost, and it's this profound sense of what they call clinical disconnect. It's a crazy paradox when you think about it. On the one hand, you have almost zero interaction with patients. You almost never meet the people whose images you spend hours analyzing. But on the other hand, your impact on them is enormous. Your one-page report could be the single thing that decides if a person goes into major surgery or gets to go home.
And this, right here, is the deep, emotional truth of radiology. You're like a ghost in the medical machine. You're the one making the diagnosis that saves a life. You catch the cancer early, you tell the surgeon exactly where to go, but the patient will never, ever know your name. There's no thank you, doctor. It's a really heavy, silent weight to carry.
So as the hours grind on, this fatigue starts to creep in. And it's not the kind of tired you feel after a workout. It's this deep mental exhaustion that comes from analyzing over 100 complex cases, staring at screens for hours, and just dealing with a constant state of information overload.
And this is where it gets really dangerous. When your brain is just fried, your focus blurs. The tiny, subtle differences between what's normal and what's deadly start to fade away. By the end of a long shift, every CT scan can start to look the same, and that's exactly when the risk of a mistake skyrockets.
Okay, so what about that myth of no night emergencies? Yeah, let's just go ahead and completely debunk that right now, because that dark room, it gets a whole lot more intense after the sun goes down.
The night is just a cascade of emergencies. The phone rings, it's a trauma CT from a massive car crash, and the surgeon needs to know about internal bleeding right now. Before you can even finish that report, an alarm goes off. It's an emergency MRI for potential stroke.
Then the phone rings again for an urgent ultrasound. Chill is the last word you'd ever use to describe it.
So, after looking at the day, the night, the pressure, the isolation, you start to get a final diagnosis for the specialty of radiology itself.
I mean, given everything we've just talked about, you've got to ask, why would anyone choose to do this? Well, there's some pretty big trade-offs. The potential for good earnings and a better work-life balance, eventually, is a huge draw. For some, not having to deal with the chaos of direct patient care is a massive plus. And for many, it's the pure intellectual thrill of being the ultimate medical detective.
And that really gets to the heart of it all. The struggle is absolutely real. The responsibility is immense, and the exhaustion is profound. Radiology isn't any less difficult than other specialties. It's just that the fight happens in silence, behind the scenes, lit only by a computer screen. So I'll leave you with this final thought. The next time you hear about a medical specialty being chill, maybe think about the unseen battles being fought. Every doctor has their struggle. Some are just a lot louder than others. And the silent struggle of the radiologist? It's